Last one, menopause. Okay, so what are the basic facts about menopause? So menopause means end of menstruation. Women can have hormone shifts, atrophy of reproductive organs, pubic hair may start to thin and disappear, vaginal dryness can cause an increase in pH, which actually can promote vaginal infections. She may also have loss of muscle tone and support, which can actually cause a uterine prolapse and frequency or incontinence for the woman. What age does menopause usually start? It usually starts at around 51.5 years old, and the average length is about 3.8 years. Most common symptoms would be hot flashes, night sweats, loss of libido, vaginal dryness, and mood swings. So why do some women begin early and others later in life? So there's different risk factors for each. So for women who go into menopause early, if maybe they're currently smoking, lower educational attainment, separated, widowed, divorced, non-employment, history of heart disease, and then factors for why a woman might go into menopause later would be priority, prior use of oral contraceptives, or a Japanese race or ethnicity. And then why can you still get pregnant during the onset of menopause? And the reason for that is, yes, you can still get pregnant. And the reason for it is there's a decrease in estrogen. However, there is an increase in the FSH, and that means that the woman can actually still be fertile because of the FSH being increased. In general, what are the pros and cons about taking hormone replacements? So in terms of estrogen versus estrogen progesterone therapy, so we know estrogen is used only if the woman has no uterus, and then estrogen progesterone if she does have a uterus. A pro for hormone replacement would be that it could actually decrease hip fractures and severity of osteoporosis. However, the cons would be increased risk for breast cancer is kind of debatable, but potential. It increases thromboembolism, and there's also an increase in stroke. Risk factors for other ones for women of menopausal age. So I said osteoporosis, cardiovascular changes, cognitive function, and cancer. So with these things to minimize osteoporosis, you could promote weight-bearing exercises, stop smoking, alcohol in moderation, take supplements like calcium and vitamin D, help promote bone growth. Cardiovascular changes, so this we know as estrogen decreases, the chance for getting something like an MI or a stroke is higher. So I'd recommend exercise and potentially estrogen replacement therapy to help decrease the risk, I believe. Cognitive function, it explained in the book as well as the notes that a drop in estrogen can cause serotonin levels, which play a role in mood and cognitive function. So that can actually be a risk for the woman. And then another would be cancer. Prolonged use of estrogen replacement therapy has actually been seen to cause certain types of cancer. So I'd recommend getting tested and screened, as well as knowing your history and your genetics to see if you're at risk for developing it. And then what dietary or lifestyle recommendations can I make for all women? So prevention is the best thing to do. Osteoporosis, we said weight-bearing exercises, strengthen the bone, and then complementary and alternative therapies would include things like supplements, calcium, vitamin D, soy with the phytoestrogen, acupuncture, and exercises. And we're done.